So, this is a story that we've seen before, right? If you think back into the 90s and the 2000s, this is the same story we had with PCI, right? When PCI first came out, I remember when I was going through medical school and I was telling the cardiologist I want to be a heart surgeon. They're like, why would you want to do that? You're never going to have a job. There's not going to be any role for a surgeon. Everything's going to be interventional. Well, what we've seen over time is, again, the early studies were all cherry-picked patients. And when you look at the broader group and you follow these patients long enough, what shows times and time again is that surgery outperforms PCI when it comes to severe disease, with left main and multivessel disease. And we're seeing the same thing. Early studies, cherry-picked patients, TAVR did come out ahead. And it's easy to see why. You're getting a puncture versus a surgery. However, what's now coming out in the last 6 months, a year, and will continue to come out, is now showing what happens to these patients long-term. And it's clear that long-term, what is happening is that surgery is better for these patients long-term. Now, ultimately, all of you in the audience, you want to do what's best for your patient. And you want to send your patient and make sure that not only they're alive today, but also in the future. And as surgeons, what we got to do is we got to continue to deliver great outcomes. If I'm doing a SAVR operation and I'm doing it with a 5% mortality, I should not be doing this operation. We got to continue to do great operations with very low risk, less than 1%, less than 0.5%. We got to do root enlargements so that we give these patients options long term and make sure that the patient has all the options available for them in long run. Again, lifetime management does not mean we need to stuff in as many operations and procedures into a patient throughout their lifetime and a limited lifetime. What it means is we need to get these patients having a full life expectancy matched to the general population and age and gender with the least amount of procedures. And ultimately, it's going to be done with a combination of surgery and interventions. So, this is all in the spirit of debate. Dr. Kapadi is a great friend, a mentor, and work very closely with him, and I look up to him in many ways. However, when it comes to this debate, it's clear that SAVR is the better option.